If you live in a country where typhoid fever is rare, you're at increased risk if you work in or travel to areas where typhoid fever is established, especially if you travel to visit family or friends. People visiting loved ones may have higher social pressure to drink or eat foods that present a higher risk. Consider Mr. Putin, who is from a country where typhoid fever is rare. Working as a clinical microbiologist handling typhoid bacteria, he will be at increased risk of having typhoid fever. Now let's consider Mrs. K, who developed typhoid fever after traveling to a country where typhoid fever is endemic. All her close contact and family members living with her will be at increased risk of having typhoid fever if no preventive measures are taken. If you traveled and feel sick, particularly if you have a fever and other typhoid-related symptoms as explained in the previous video, talk to a healthcare provider and tell them about your travel. If you live in countries with high incidence of typhoid fever, your chance of having typhoid fever is very high if you don't take any preventive measure. People can get vaccinated against typhoid fever. This is an option if you live where typhoid fever is common. It is also an option if you plan to travel to a place where the risk is high. 2 vaccines are commonly available for people aged 2 and older. One is given as a single shot at least 1 week before travel. One is given orally in 4 capsules, with 1 capsule to be taken every other day. The effectiveness of these vaccines wears off over time, so repeat immunization as needed. Typhoid vaccines are only 50 to 80% effective, so you should still be careful about what you eat and drink to lower your risk of getting typhoid fever. Also, there isn't a vaccine that protects against paratyphoid fever, and because the vaccine won't provide complete protection, for these reasons, it's very important that you also take the following steps to prevent typhoid fever. 1. Wash your hands. Frequent hand washing in hot soapy water is the best way to control infection. Wash before eating or preparing food and after using the toilet. Carry an alcohol-based hand sanitizer for times when soap and water aren't available. 2. Avoid using untreated water. Contaminated drinking water is a problem in areas where typhoid fever is common. For that reason, drink only bottled water or canned or bottled carbonated beverages, wine and beer. Carbonated bottled water is safer than non-carbonated bottled water. Ask for drinks without ice. Use bottled water to brush your teeth, and try not to swallow water in the shower. 3. Because raw produce may have been washed in contaminated water, avoid fruits and vegetables that you can't peel, especially lettuce. To be safe, you may want to avoid raw foods. 4. Choose hot foods. Avoid food that's stored or served at room temperature. Freshly made, steaming hot foods may be less risky than uncooked foods. 5. Know where the healthcare providers are. Find out about medical care in the areas you'll visit. Carry a list of the names, addresses, and phone numbers of healthcare providers. Where typhoid fever is common, access to treated water helps avoid contact with the Salmonella enteric serotype typhoid bacteria. Management of human waste also helps people avoid the bacteria. And careful hand washing for people who prepare and serve food is also important. Remember Mrs. K, who developed typhoid fever after traveling to a country where typhoid fever is endemic. All her close contact and family members living with her are now at risk of having typhoid fever. To prevent infecting others, Mrs. K will need to 1. Take her antibiotics. Follow her healthcare provider's instructions for taking her antibiotics and be sure to finish the entire prescription. 2. Wash her hands often. This is the single most important thing she can do to keep from spreading the infection to others. Use hot soapy water and scrub thoroughly for at least 30 seconds, especially before eating and after using the toilet. 3. Avoid direct handling food. Avoid preparing food for others until her healthcare provider says she is no longer contagious. If she work with food, she may need to take a test to show she aren't shedding typhoid bacteria. If she work in healthcare, she may need to show she aren't shedding the bacteria. All travelers to endemic areas are at potential risk of typhoid fever, although the risk is generally low in tourist and business centers where standards of accommodation, sanitation, and food hygiene are high. Typhoid fever vaccination should be offered to travelers to destinations where the risk of typhoid fever is high. The following recommendations will help ensure safety while traveling. 1. Ensure food is properly cooked and still hot when served. 2. Avoid raw milk and products made from raw milk. 3. Drink only pasteurized or boiled milk. 4. Avoid ice unless it is made from safe water. 5. When the safety of drinking water is questionable, boil it, or if this is not possible, disinfect it with a reliable slow-release disinfectant agent usually available at pharmacies. 6. Wash hands thoroughly and frequently using soap and water for at least 20 seconds, in particular after contact with pets or farm animals and after using toilet and bathroom. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. 7. Keep your hands away from your face and mouth. 8. Wash fruits and vegetables carefully, particularly if they are eaten raw. If possible, vegetables and fruits should be peeled. 9. Buy bottled water or bring local water to a rolling boil for 1 minute before you drink it. Bottled carbonated water is safer than uncarbonated water. 10. Eat foods that have been thoroughly cooked and are still hot and steaming. 11. Avoid raw vegetables and fruits that cannot be peeled. Lettuce can remain contaminated even after it is washed. 12. Wash your hands with soap and water before eating. 13. Avoid foods and beverages from street vendors unless steaming hot. Check if the typhoid fever vaccination is recommended for the country you are going in the next video. 2 typhoid vaccines are available. Visit your doctor or a travel clinic at least 1 month before traveling to discuss your options. You can also contact us if you need more information. Please subscribe to our channel to keep getting more tips on how to stay healthy. Thanks for watching.